If you're a health professional working with women who are struggling after breast cancer surgery and axillary node dissection with limited arm movement and cording, this is the video for you. We're going to show how to increase that range of movement without compromising the lower back. What's really important before you start is to get a look of their range of movement. You want to make sure they're standing nice and upright, and as they move, they're not compromising their back and starting to tilt. So have a look at the normal range first, go up as far as you can. Lovely. And then we're going to have a look at the affected arm. Watch their face for when they start getting into any pain and whether or not they start to tilt back and hurt their back. Notice if there's any obvious axillary wedge syndrome cording coming down the arm, which may show up as a strong fibre pronouncing from the axilla. So we're going to look at how best to get in position in order to help with that range of movement. You may be doing this in the middle of a treatment, so it's a good idea to take another look at their range before you apply the technique so that you can reassess whether or not your positioning's been correct and you've made a change before you get them up off the table. So let's take another look at that arm range of movement. So when you're ready, just take that arm up and then bring that arm down. So what we're looking at is how we're going to change the tension in order to change the proprioceptive feedback she's getting while she's doing that movement, because once we get to a certain position, not only is the tissue limiting her, but she's getting some neural responses, creating pain and stopping her from going any further. So whether or not your client has got a separate axillary node dissection scar or has got some scarring related to a breast reconstruction, lumpectomy, wide local incision or mastectomy scar, we're going to make sure that you take your hands to cover the scarring and go a little behind it. Make sure the arm isn't overly stretched before you get in position, otherwise you're going to be more limited in how much you can achieve. So bring the arm in a little, lock around the scar tissue and then ask your client to take that arm up as high as they can go comfortably. If you've got some cording, this will pronounce as some tight bands going up the arm, possibly even going up towards the hand, and this should help with that cording as well. Don't stay at end of range for too long. You're going to lock on the scar. They're going to do some nice smooth movements as far as they can go comfortably and back again. So in your own time. Let's do that a couple more times. To take it a step further, you can ask them to breathe in as they extend the arm back, breathe out as they bring the arm down. And with my hands, the most pressure is coming in under my fingers. So double up your hands to make sure you're really protecting yourself. Then when you're ready, come off and reassess movement. Considerations and cautions for this technique. It's really important that you start this technique having discussed with your medical team that they want you to start working on your range of movement with your arm. Too early, you could be damaging some of the internal suturing around your surgery site. So have a chat with your medical team first. Secondly, if you have an existing condition of lymphedema or you have some swelling in the arm or in the breast area, make sure you speak to your medical team first before doing this technique, because there could be some development of lymphedema happening, or it's important that they're happy for you to go ahead with this range of movement technique. Thanks for watching, and please check out the other videos we've got together.